What if I told you that a huge chunk of what we would all consider routine, essential healthcare isn't even covered by Medicare at all? What if I told you that the 5 most common health expenses that you'll face in retirement could leave you with bills for thousands or even tens of thousands of dollars that you have to pay out of your own pocket? Now, I'm not saying this to scare you, it's just the reality that shocks millions of Americans every single year. They get their Medicare card in the mail, have a sigh of relief, and then the first bill for a dental cleaning or a new pair of glasses shows up, and the floor drops out. My name is Tim Smith, and as an insurance agency owner specializing in Medicare, I've had so many conversations with people who are confused, frustrated, and honestly a little scared about these hidden costs. My goal today is to pull back the curtain. We're going to walk you through step by step the top 5 biggest and most common costs that original Medicare Part A and Part B does not cover and will not pay for in 2025. But I'm not just here to point out the problems. For each of these 5 gaps, I'm going to show you exactly what your options are to get them covered. We'll talk about the specific types of plans and strategies that you can use to fill these gaps in coverage, often for a reasonable cost. And by the end of this video, you won't just understand the risk, you'll have a clear, actionable roadmap to protect your health and your savings. So let's get started. The first major coverage gap that catches almost everyone by surprise is routine dental. Let me be perfectly clear. Original Medicare does not cover most dental services. This includes the things that we all think of as standard maintenance, regular checkups, cleanings, fillings. None of them are covered. Now, there's a tiny exception in the fine print, but it only applies to a very few amount of people. Medicare Part A, your hospital insurance, might cover some dental services if you're already in the hospital for another covered reason. And that's only if that dental work is a necessary part of your treatment. For example, if you were in a bad accident and needed complex jaw surgery, Medicare would likely cover the dental work needed to fix your jaw. But for 99% of dental care that most people need, the cleanings, the fillings, the dentures, you're on your own. You will pay 100% of that cost out of your pocket. Now, why is this such a big deal? It's because dental problems don't just go away. They get worse and way more expensive over time. A small cavity that could have been a simple filling can turn into a painful root canal or a crown, and those can cost easily up to $2,000 or $3,000. Now imagine needing more than one and a full set of dentures. You can run several thousands of dollars. These are not just small expenses, especially when you're on a fixed income. On top of that, we now know that your oral health is deeply connected to your overall health. Bad dental hygiene is linked to a higher risk of heart disease, diabetes complications, and even respiratory infections. So ignoring your teeth because of the cost isn't just a risk to your mouth, it's a risk to your whole body. So what can you do about it? You have to be proactive. You've got a few solid options to get the coverage you need. Number 1 is Medicare Advantage. This is the most popular route. Medicare Advantage plans are offered by private insurance companies that are approved by Medicare. They have to cover everything that original Medicare does, but they usually bundle extra benefits like dental, for example. For 2025, the huge majority of Medicare Advantage plans, we're talking almost 97% or more, offer some kind of dental, vision, and hearing benefit. But, and this is important, not all dental benefits are the same. You have to look at the details. Some might only offer preventative coverage, which includes your annual cleanings, exams, and x-rays for free, but it won't help you if you need a crown or any other major work done. Now, other plans offer more comprehensive care. This covers things like fillings, extractions, root canals, and even dentures. But there are always limits. The most important number to find is the annual benefit maximum. This is the total dollar amount that plan will pay for dental care in a given year. A common amount is between $1,000 up to $2,000. So if your plan has a $1,500 maximum, it covers your cost up to that amount. Once you hit that $1,500, you're paying 100% the rest of the year. Now, you also want to check the co-insurance. For a big ticket item like a crown, a plan might pay 50%. So on a $2,000 crown, the plan will pay $1,000 and you pay the other $1,000. These plans often are HMOs or PPOs, so you'll probably need to use a dentist in their network to get the best price. Now, the biggest appeal is that many of these plans have a $0 monthly premium, which makes them a great way to bundle everything together if you're needing dental, vision, and hearing. Now, if you'd rather stick with original Medicare, or if the dental benefits on local Advantage plans aren't strong enough, you can buy a standalone dental insurance policy. These are private plans that you can buy completely separate from Medicare. The big upside here is you have the choice. You can shop around and find a plan with the exact benefits that you need. You might find a plan with a higher annual maximum. Some of them even go up to $5,000 or even more every single year. Now, the downside is you'll be paying a separate monthly premium, probably somewhere between $30 and $60 more per month. Another important thing to know about standalone plans is there's normally waiting periods. Most will cover cleanings right away, but they'll make you wait oftentimes 6 to 12 months before they'll help pay for any major work like crowns or dentures. And they do this to keep people from signing up right away when they need expensive work done and then dropping the plan entirely. So if you go this route, it's best to sign up before you have a problem. This third option is a little different. A dental discount plan is not insurance. Think of it as like a membership club. You pay an annual fee, maybe $100 or $200, and you get access to a network of doctors who have agreed to give members a discount. That discount could be anywhere from 20 to 50% or more. The main perks of a discount plan are that there are no waiting periods, no annual maximums, and no deductibles. If you need a crown tomorrow, you can sign up today and get the discount right away. The catch is that you still have to pay the discounted bill yourself when you get the work done. It doesn't just pay for your care, it just lowers the price. This can be a great option if you need work done immediately or if your dental needs are more than a typical insurance policy will cover in a given year. Next on our list is another routine cost that original Medicare leaves you to handle, which is vision care. Just like with dental, Medicare Parts A and B do not cover routine eye exams to get a prescription for glasses or contacts. And just as important, it doesn't pay for the glasses or contacts themselves. Think about how common it is for our eyesight to change as we get older. Needing new glasses every year or 2 years is pretty standard. A new pair of prescription glasses can easily cost a few $100s. And if you need progressive or special coatings, that price climbs fast. These are predictable costs that your Medicare card will not help with. Now, it's really important to understand the difference between routine vision care and medical eye care. Medicare doesn't cover the diagnosis or treatment of medical eye conditions. So if you have glaucoma, macular degeneration, or cataracts, your visits to manage those conditions are covered by Part B. Cataract surgery is a covered expense, and Medicare will even pay for one pair of standard eyeglasses after this surgery. But the key is that it has to be linked to a medical procedure. If your vision is just a little blurrier than last year and you need a new prescription, that's routine and you're paying the full cost. For a lot of seniors, this can add up to hundreds of dollars a year. So how do you handle this? The solutions are going to look pretty familiar. Again, Medicare Advantage plans are a great place to look for vision care. As we said, almost all of them bundle this in the extra benefits category. A typical vision benefit will give you a free or low copay routine eye exam every single year. And the plan will give you an allowance for your glasses or contacts. This is a set dollar amount that you can use towards your eyewear. A common allowance is between $100 and $300 a year. So if a plan has a $200 allowance and your glasses cost $275, you'd use the $200 credit and pay the last $75 yourself. But just like the dental, read the fine print. You'll need to see an eye doctor in that plan's network. And the allowance might have rules about what it covers. For example, it might cover basic lenses, but you'd pay extra for anti-glare coatings. For many people, this is enough to cover most of their yearly vision costs. Now again, if you want to stick with original Medicare or you need better vision benefits than the local Medicare Advantage plans, you can pay a monthly premium, often between $15 and $30 a month, and you can get a separate plan that covers your annual eye exam and provides a generous allowance for glasses or contacts. Sometimes the allowance is higher than what you'd find on a Medicare Advantage plan. The main benefit is flexibility. The downside is that you have an extra monthly bill. Number 3 is retail and membership discounts. Don't forget about the discounts. Big retailers like Costco and Walmart oftentimes have affordable exams and eyewear packages that can be competitive even without insurance. Also, group plans like AARP offer vision discount programs to their members. It's always worth checking if you belong to any group like that offers this kind of benefit. It's not insurance, but it'll definitely lower your costs. The third major gap in Medicare is one that hits millions of older Americans with a huge price tag, and it's hearing aids. Let me say this as clearly as I can. Original Medicare does not cover routine hearing exams, and it does not cover the cost of hearing aids. For many people, this is the most shocking out-of-pocket cost that they face. Hearing loss is incredibly common as you get older, and the problem is the cost. Hearing aids aren't just amplifiers, they're complex medical devices. A single prescription hearing aid can cost between $1,000 up to $3,500. and most people need 2. That means you could be looking at a bill from $2,000 up to $7,000, and that's a massive expense that most retirees just aren't ready for. So with Original Medicare not helping, what are your options? Just like the dental and vision, Medicare Advantage plans are the main solution here. A typical hearing benefit works in one of 2 ways. First, the plan might offer a fixed dollar allowance, maybe $1,000 per ear every couple of years. The second, and the more common way, is a co-payment system. The plan partners with a hearing aid company like True Hearing, for example. Through this deal, members can get specific hearing aid models for a fixed low copay. For instance, you might get a good mid-range hearing aid for $690 copay per ear, or a premium model for $999, when those same hearing aid costs could be $2,500 each at retail. These plans also usually cover your hearing exam for free. This is often the most cost-effective way to get high-quality hearing aids. Number 2 is over-the-counter hearing aids. This is a fairly new and exciting development. A few years ago, the FDA approved the sale of hearing aids directly to consumers over the counter. These over-the-counter hearing aids are for adults with what they would perceive to be mild to moderate hearing loss. A pair of quality over-the-counter hearing aids might run from a few $100s up to $1,500. It's a much more affordable starting point. You can buy them online or in big box stores. The trade-off is that you fit them yourself, usually with a smartphone app. They might not be as powerful or customized as a prescription device fitted by an audiologist, but they are a fantastic option for people with mild to moderate needs. Number 3 is standalone hearing insurance or discount programs. While they're less common, you can find some standalone insurance plans for hearing care. They work just like dental or vision plans, with a monthly premium for a set amount of benefits. More common are discount programs from hearing aid clinics or groups like AARP that can give you a percentage off the retail price. Alright, so we've covered the big 3, dental, vision, and hearing. Now I hope this is already clearing things up for you. If you're finding this helpful, do me a quick favor and hit that like button. It really helps the channel get this info out to more people that need to hear it. And make sure to subscribe as well, because we're about to dive into the 2 absolute biggest potential costs in retirement, the ones that can truly wipe out a lifetime of savings if you aren't ready. So you do not want to miss this. And remember, this is all general information. If you want to see exactly which plans in the specific zip code that cover these things, there's a link down below in the description for a totally free, no obligation call with me or one of my team members. We'll go over all the different plans in your area. Now let's get to number 4, which is long-term care. This is the conversation that nobody wants to have, but everyone needs to. The single biggest potential expense you can face in your later years, one that can destroy an entire family's net worth in a shockingly short amount of time, is long-term care. And Original Medicare does not pay for it. Now let me be very specific. We're talking about custodial care. This is non-medical help with basic activities of daily living, like bathing, dressing, eating, or getting in and out of bed. It's the kind of care someone needs when they have a chronic condition, a disability, or a cognitive decline from something like Alzheimer's. This care can happen at home, in an assisted living facility, or in a nursing home. This is where the most dangerous myth about Medicare lives. People think Medicare pays for nursing homes. For long-term care stays, this is not true. Medicare Part A will only cover skilled nursing care under very strict rules. It has to come after a hospital stay of at least 3 days, and it has to be for recovery. For this skilled care, Medicare covers the first 20 days completely. From days 21 to 100, you pay a daily coinsurance, which is $209.50 a day in 2025. After day 100, Medicare pays $0. So if you have a stroke and need intensive physical therapy to learn to walk again, Medicare helps with that short-term rehab. But if after 100 days you still need help getting dressed, that becomes custodial care and Medicare coverage stops. And at that point, you're paying the full cost. A private room in a nursing home is projected to cost over $10,000 a month in 2025. And that's over $120,000 a year. Assisted living can average over $6,000 a month. These costs can burn through your entire life savings in just a couple of years. So if Medicare won't pay, what do? This is a massive problem, and the solutions require planning way ahead of time. Number 1 is long-term care insurance. The most direct way to pay for this is to buy a long-term care insurance policy. You pay a premium, and if you need the care later and meet the policy's criteria, the policy pays a benefit to cover your care costs. The catch? You need to buy these policies when you're younger and healthier, usually in your 50s or early 60s. If you wait, the premiums can get incredibly expensive, or you might not be able to qualify at all. Number 2 is hybrid life long-term care products. These have become very popular. They combine a life insurance policy with a long-term care benefit. The idea is simple. If you need long-term care, you can use a portion of the death benefit while you're alive to pay for it. If you never need care, your family gets the full death benefit when you pass away. It solves the use it or lose it problem of traditional policies and can be easier to qualify for. Number 3 is personal savings and investments. For some people with a lot of resources, self-insuring is an option. This means setting aside a huge chunk of your assets just in case you need long-term care. This takes a lot of discipline and a portfolio big enough to handle a drain of over $100,000 a year for several years without putting a surviving spouse in financial jeopardy. Number 4 is Medicaid. For people with very little income and assets, Medicaid is the final safety net. Medicaid will pay for long-term care in a nursing home, but to qualify, you have to spend down almost all of your assets to a very low level, usually just a few $1,000s. It's a crucial program, but it means you've exhausted nearly all your money to get there. The bottom line for long-term care is that you need a plan. Relying on Medicare is not a plan. It's a direct path to financial trouble. The 5th and final major cost is one that affects almost every single senior, and it's outpatient prescription drugs. This is another area where original Medicare has a huge gap. Part A helps cover drugs you get during a hospital stay, and Part B covers a very small list of outpatient drugs, like certain infusions you get in the doctor's office. But for the prescriptions you pick up at the pharmacy, pills for high blood pressure, cholesterol, diabetes, original Medicare pays zero. You pay 100% of the cost. Since most seniors take multiple medications, these costs can get out of control really fast. Thankfully, the solution here is very straightforward. You must enroll in a Medicare prescription drug plan, and you have 2 ways to do it. If you stick with original Medicare, you need to sign up for a standalone prescription drug plan or Part D of Medicare. You pay a monthly premium for the plan, which in 2025 is estimated to be around $45 to $50 on average, though it can be a lot higher depending on the plan and location. Every Part D plan has a formulary, which is a list of covered drugs. It's so important that you check your specific medications and make sure that they're on that list. Drugs are usually put into tiers. Tier 1 might be cheap generics, while higher tiers have more expensive brand name drugs with higher copays. For 2025, Part D has a massive game-changing improvement. There is now a $2,000 annual cap on your out-of-pocket spending for covered drugs. This means once you've spent $2,000 total in any given year, that includes your deductible and copays, you will pay $0 for your covered drugs for the rest of the year. This is an incredible new protection for people on expensive medications. The annual deductible for Part D in 2025 can't be more than $590, though many plans have a lower one. Number 2 is Medicare Advantage prescription drug plans. The other way to get drug coverage is with a Medicare Advantage plan that includes drug coverage. This bundles your hospital Part A, medical Part B, and drug coverage all into one. The drug coverage works just like a standalone Part D plan. It has a formulary, tiers, and that same $2,000 out-of-pocket cap for 2025. The appeal here is simplicity. You can often get a plan with a $0 premium that covers your medical, drug, dental, vision, and hearing needs all in one package. The most important step, no matter which one you choose, is to use the Medicare Plan Finder tool on Medicare.gov. You can type in your prescriptions and it'll show you all the plans in your area and the estimated cost for your specific medications. This is the single best thing that you can do to pick the right plan. And a quick word of warning, if you don't sign up for a drug plan when you're first eligible and don't have any other drug coverage, you could get hit with a permanent late enrollment penalty if you try to sign up later. It's crucial to get your drug coverage sorted out right from the start. So let's do a quick recap of the 5 major costs original Medicare won't pay for in 2025. First is routine dental care. Second is routine vision care. Third is routine hearing care and hearing aids. 4 is long-term custodial care. And 5 is outpatient prescription drugs. Looking at that list can feel overwhelming. The potential costs are genuinely scary, and it's easy to see how someone could get into financial trouble if they aren't prepared. But I don't want you to leave this video feeling scared. I want you to feel empowered. For every single one of these gaps, there is a solution. You are not helpless. By being proactive and making smart choices, you can build a healthcare plan that protects you. Whether it's a Medicare Advantage plan that bundles everything together, separate standalone plans, or a specific strategy for long-term care, you have tools you can use to get the security you deserve in retirement. The system is complicated, but it's not impossible to figure out. Your first step is just to know these gaps exist and then take action to fill them. Don't wait for a toothache to turn into a $2,000 root canal. Start asking these questions. The time to plan is right now. Now, I know we covered a ton of information today. Trying to compare all these different plans on your own can be a real headache. That's what we're here for. The best way to sort through all this is to talk to an independent licensed agent who can look at all the options from all the different companies in your specific area. And that's where we come in. We can help you find the right plan that covers your doctors, your prescriptions, and fills in these gaps in the most affordable way for you. And the best part is all of our services are 100% free of charge. The insurance carriers pay us, so you never pay us a dime for our help. So if you'd like to schedule a free, no obligation chat with myself or one of my team members, just click the link down below in the description of this video and you can book a free one-on-one call, or feel free to call the number on the screen and we'd be more than happy to help you. Now, thank you so much for watching this. I hope you found this video truly valuable. If you did, please subscribe and click the notification bell so you don't miss any of our future videos where we break down Medicare. Now go check out this video where we go over all the 2026 changes and the price updates. Stay informed and we'll see you in the next one.